Welcome, everyone, to another episode of Office Hours. I'm your host, Stuart Newsome, and today I'm flying solo. This will be a short session, but it's equally a very important one. So, we're going to be diving into a topic that is transforming revenue cycle management, and I'm talking about AI agents and advanced document capture solutions. So, if you've been following our conversations, whether it's here on Office Hours or in our podcast, Revenue Cycle Optimize, which I highly recommend you subscribe to stay up to beat on what's happening out there, and you know that we've been talking about automation and AI and how both of those are becoming increasingly vital in streamlining administrative processes. Now, today, we're going to take a closer look at how AI is tackling one of the most frustrating challenges in healthcare, and that is document management. Now, we've all seen how, document processing can be a bottleneck, whether it's imaging centers dealing with an overwhelming number of faxes, radiology practices trying to extract data from referrals, or specialty clinics managing prior authorizations. The inefficiencies add up very quickly. Now, manual processing, reliance on outdated OCR technology, and inconsistent workflows can create errors, delays, and ultimately a hit to reimbursement, and nobody likes that. So today, we're going to break down how AI agents are stepping in to change the game. We'll discuss the evolution from manual processes to OCR, why OCR wasn't a complete solution, and how AI-powered agents are revolutionizing document capture and data entry. So I got my notes ready, so I'm ready to dive right in. So I thought we would start, first of all, by looking at how document processing is typically handled today. Now, in a traditional manual workflow, incoming faxes have to be sorted into queues by staff members. Then they have to be categorized based on the type of request, again, by staff members. Then manually entered into the appropriate system, again, by staff members. This meant that someone had to look at each document, determine its purpose, key information like patient demographics, insurance details, or referring provider notes. Then that information has to be accurately entered into, say, a risk system, an EHR, or a billing system. Pick the information system of your choice. Now, the challenges? Well, first, it's very time consuming. Sorting through hundreds of faxes, maybe even thousands of faxes daily, it creates major backlogs, especially for high volumes, specialties like radiology, cardiology, and whatnot. So, second, it's prone to human error. Misreading, handwriting, missing critical details, or entering incorrect data could lead to claim denials and delays in patient care, particularly handwriting. We all know how physician handwriting can be. And finally, because every document required hands-on processing, it limited scalability. More documents meant hiring more staff, leading to higher administrative costs. Well, then came OCR to the rescue, right? Which most of you know stands for optical character recognition, which was supposed to be the game changer. But OCR actually was very effective in that it could scan printed or handwritten text. It converted into digital characters and automatically populated data fields. Now, on paper, this was a huge leap forward. It took some of the burden off staff members by automating data extraction, allowing for a faster processing. And I can recall when this came out, I thought this is really cool. Don't have to manually enter any information, just scan it in, OCR recognizes it and pulls it into the fields. But the reality, OCR alone really wasn't enough. This is what we found. While it could recognize text, it didn't understand context. It struggled with messy handwriting, inconsistent document formats, and variation in provider notes. And in many cases, the extracted data still had to be manually reviewed and corrected before it could be used. Plus, OCR limitation. It didn't integrate seamlessly with other systems. It really didn't play nice with others. So extracted data often had to be manually copied and pasted into EHRs or billing platforms, creating additional steps instead of eliminating them. In fact, it seemed the inconsistencies of OCR were so bad, it was easier and faster to manually extract and enter the data than it was to decipher the text OCR extracted. So it added to the labor. So while OCR helped speed up certain aspects of document processing, it didn't solve any underlying inefficiencies. The need for human intervention remained and was a dominating factor, and the process still lacked the intelligence to adapt to different types of documents and workflows. Now let's talk about AI agents. Now, if you've been following our previous conversations, again, here on Office Hours or at a Revenue Cycle Optimized podcast, there's plenty of material out there. And you may have heard me mention, as well as some of our guests, such as Navneet there, Natalia, as well as Charu. We have many subject matter experts here that have talked about it, ad nauseum at least. You may have heard us talk about AI agents before, but let's quickly define what they are and how they differ from traditional automation. An AI agent is essentially automation personified. That's the best way I could describe it. It's a digital entity with a specific set of skills, leveraging machine learning models, large language models, and generative AI to reason, adapt, and make intelligent decisions. Now, unlike traditional automation, which follows rigid workflows and rule-based scripts, AI agents can process information dynamically, adjust based on real-time input, and even engage in problem solving within a defined scope. Now, think of it as a digital delegation. Instead of assigning tasks to a staff member, you assign it to an AI agent that specializes in that specific function. And multiple AI agents can work together. Think of them as digital crews, if you will. Together, they accomplish a broader set of tasks, creating a highly efficient workflow. Now, let's consider how this applies to radiology. One of the biggest pain points, particularly for imaging centers, is handling document-heavy processes. Whether it's prior authorization requests, eligibility verification, or insurance information, a significant amount of data will still come in through faxes, PDFs, or even handwritten physician orders. Imagine an AI-powered workflow where incoming documents are instantly categorized with AI agents handling each step of the process. Now, to capture the information, a categorization agent immediately identifies the document type, whether it's a referral, prior authorization request, or even a patient record, without the need for any human sorting. Then a data extraction agent pulls out key information such as patient demographics, referring provider details, and insurance data. But instead of just extracting like OCR, this AI agent understands the context of the data, ensuring its accuracy. And that's where the validation agent comes in, where it cross-references the extracted details against existing patient records. If something is missing or unclear, it doesn't simply pass the document through, it flags it for review and directs it to a human agent. And finally, there's the auto entry agent. This ensures that the validated data is automatically entered into the radiology information system. As everyone knows, in radiology is a RIS system, thus eliminating the need for any manual re-entry. Now, AI agents are not just limited to radiology. In cardiology, for instance, AI-powered solutions are streamlining prior authorization workflows by ensuring that all necessary documentation is available before submission, reducing administrative burdens and expediting approvals. Now, in pathology, AI agents enhance efficiencies by verifying that the lab orders are correctly matched with the patient data and the billing systems, reducing manual interventions. Now, beyond these specialties, hospital systems are leveraging AI agents to optimize both inpatient and outpatient workflows, from patient intake and insurance verification to discharge planning and claims processing. AI-driven automation agents are really improving accuracy and reducing time needed to move patients through the systems. Additionally, AI-driven document capture is proving valuable in orthopedic and oncology clinics, where high volumes of patient referrals, treatment authorizations, and follow-up documentation require meticulous handling. By incorporating AI agents into these processes, healthcare organizations are not only reducing costs, but also improving patient care by minimizing administrative delays. Now, the ability to intelligently categorize, extract, validate, and route information is transforming how healthcare providers manage their revenue cycles, leading to increased efficiencies, fewer denials, and ultimately better financial performance. Now, when we talk about AI agents in revenue cycle management, we can't just focus on how it works. And speaking of financial performance, as I mentioned earlier, we really need to understand what it delivers. And at the end of the day, healthcare organizations want to know what's the return on investment. Well, the biggest impact of AI agents and what they have is really in reducing the labor cost while improving accuracy. Now, right now, a lot of healthcare facilities are devoting significant resources in both time and money to document processing. Whether it's prior authorizations, referral processing, or insurance verification, staff are manually sorting, categorizing, extracting data, validating it against patient records, and finally entering it into their respective information system, whether it's an EHR, billing system, RIS, lab information system, what have you. This isn't just tedious, it's inefficient. Now let's put some real numbers to this. Now imagine a mid-sized provider organization currently has 10 full-time employees dedicated solely to handling incoming faxes and documents. Now, what's their job? Well, like we said at the beginning of this segment, they're sorting through queues, figuring out what each document is, extracting relevant details. Then they're verifying them and then manually entering everything into their system. Now let's break down the cost. If each of these 10 FTEs are earning an average of, say, $4,500 per month, that's $45,000 per month just for document processing labor. Now, over the course of a year, that adds up to $540,000 annually, over $500,000 spent just on manually handling paperwork. Now, let's introduce an AI agent-driven document capture solution that should bring, and typically brings, of what we had found, an efficiency lift of 70%. Now that means instead of needing 10 FTEs to do this work, the organization only needs 3 because the AI agents are handling categorization, extraction, validation, and entry while the staff step in only when human review is needed. Now that's a reduction in 7 FTEs, cutting the annual cost to $162,000 per year, and that's an immediate savings of $378,000 a year if my math is correct. Now let's address the elephant in the room. AI is not here to replace staff. It's here to augment their work and make their jobs more meaningful. The reality is that staff members who were once buried in repetitive manual tasks are now freed up to focus on higher value work. Instead of spending hours sorting faxes and manually entering data, they can focus on handling complex cases, ensuring compliance, improving patient communication, and resolving reimbursement challenges proactively. And let's be honest, no one really enjoys spending or tracking down missing paperwork. These are frustrating, monotonous tasks that contribute to burnout and job dissatisfaction. AI is not replacing staff, it's eliminating the parts of their jobs that are mind-numbing and error-prone, allowing them to step into more strategic, fulfilling roles. This shift isn't just about efficiency, it's about empowering staff to do the work that require human intelligence, empathy, and decision-making. Now, AI handles the bulk of the workload, but it still needs human oversight. When an AI agent flags an exception, it's the human expert who steps in to validate and resolve it. When new document types emerge or workflows need to be adjusted, it's the human team that guides the AI to adapt. Now, there's also a compliance component here and risk mitigation factor. The more manual data entry involved, the higher the risk of errors. A missed detail on an insurance claim or a misclassified referral can lead to denied claims, delays in patient care, and even compliance violations. AI these risks by ensuring accuracy at every stage of the document workflow, reducing denials and improving first pass claim rates. And then there's scalability. As an organization grows, maybe adding more patients, more locations, perhaps some more services, the workload's naturally going to increase. And with a manual process, that means hiring more staff to keep up. But with AI agents in place, scaling up document processing doesn't require adding more people. It's just a matter of letting the system handle the increased volume, increasing its capacity, because it already knows what to do. It's already learned, so you don't have to train it again. Now that's a game changer in today's healthcare landscape, where staffing shortages are still such a major concern. So now, when we're talking about ROI, it's not just about dollars saved, though that's important, but it's about building a smarter, more agile operation while making work better for the staff who keep the revenue cycle running. It's allow healthcare organizations to be proactive instead of reactive, reducing administrative burdens while improving financial performance and patient care. Now, the math adds up. but the real value comes in the efficiency, accuracy, and peace of mind that AI agent-driven workflows provide. So what's the big picture here? Well, AI agents and advanced document capture solutions aren't just about automating tasks. They're about transforming the way we work. We've seen how the shift from manual document handling to AI-driven workflows leads to massive efficiency gains, cost savings, as well as fewer administrative burdens. But more importantly, we've discussed how this technology isn't here to replace staff, it's here to empower them. By letting AI agents take on the repetitive, high volume work, revenue cycle teams can focus on what really matters, solving complex challenges, improving patient interactions, and ensuring a smoother, more predictable financial process. Now, AI isn't a replacement for people, it's a tool that allows them to do their jobs better, smarter, and with less frustration. And as AI continues to evolve, we're only scratching the surface on what's possible. The organizations that embrace these innovations today will be the ones setting the standard for efficiency and excellency in RCM moving forward. I want to thank you all for joining me today for this conversation, and I hope it's given you some valuable insights and maybe even a new way to think about how AI agents can operate in your own workflows. If you have any lingering questions or want to continue the discussion, feel free to reach out to us. We're here to help you. Now, of course, we'll be back soon with another episode of Office Hours next week, as a matter of fact, as we have a special treat. So we'll be here to continue to dive into the most pressing topics in healthcare revenue cycle management. So thanks again for your time, and we'll see you next time. Thanks for joining.